AVS Media Demo.
Data and accountability, because accountability obviously is quite an important aspect, and there is more and more a need to, I think,
AVS Media Demo.
just a few minutes before, needs of reliable and accurate data to evaluate the impact of humanitarian response as well as development programs. And in that case, I'm opening the discussion of the development aspect, where we are finally looking at the needs for accurate data to really be able to justify not only the value for money, so did we spend the money properly, but
AVS Media Demo.
we're expecting what they needed. At the end of the day, accountability starts from, will you be happy if you will receive what you are providing? Because accountability starts there, and you don't need to look much more further. So both donors and implementing government are looking at issues such as value for money, long-term sustainability. Are we bringing something that will last long?
AVS Media Demo.
Solve the problem that will increase the resilience, another keyword that is quite used now, and the relevance of our theory of change. Because when we intervene in the development sector, we are bringing the theory of change to solve the problem. Our theory of change, which I hope our center both beneficial as well, in the formulation, is integrated.
AVS Media Demo.
Only if we have a full cycle of evaluation with the proper information. And again, in that case, donors and implementing agencies, they do have the same needs. So by coincidence, I pick a project that is funded by UAE, and this is done in South Sudan, which is a 3 years evaluation of
AVS Media Demo.
Intervention of WFP funded by the FID, where as a reach we are doing all the data collection and the analysis for the evaluation of the impact. It means that since day zero, we did the baseline, when we are doing the monitoring, we'll be able to do the review at the end of a 3-year project. So why this is important? Because it's changing
AVS Media Demo.
Just an evaluation at the end of a program, and without looking at the fact that in order to properly do that in a scientific way, you need to take that since the beginning, control group and treatment group, before the ethical question that we are asked. So information management cannot be restricted to assessment and exposure evaluation. But we need
AVS Media Demo.
Holistic approach, and by doing that, then we will be able also to merge the different needs and perspectives from the different parts. We do have challenges in the area of improvement. So a small component of program budget, and usually 1–2%, but it's the first one that is cut when the budget reduces. So is it really a priority? Because if it is, it should remain even when the budget is reduced. And this is not the case.
AVS Media Demo.
Use is good, which means if I have the data, I have the power. But actually, I have the power of my data if the data is shared. But this is still a long way to get it. Most of the implementing actors produce huge amount of data on a daily basis, but do not manage them. Imagine how much data is produced by each NGO every day. It's just an Excel sheet on a computer of someone who will leave the day after.
AVS Media Demo.
It's massive and it's unused. Data flow with donors is usually perceived as a one-way only. We provide the data to donors. The donors actually, you do have data that we don't know how to access. And a good example is, for example, the HIU from the US government, which is releasing data sets from the US government that are declassified.
AVS Media Demo.
This is another practice we should look into because it might be a good starting point. I've been very quick, I'm sorry to know, because I hope this is matching our timetable.
AVS Media Demo.
I'm going to talk about something slightly different, but on the same topic.
AVS Media Demo.
ELRA, as I said before, that stands for Enhancing Learning and Research for Humanitarian Assistance. And just very briefly, ELRA kind of sits between large donors and implementers and researchers. So we get money in from people like DFID, and then we fund
AVS Media Demo.
innovation and professionalisation. So in a way we're fund managers and we try to value add giving money. And the theme of this talk was about data, reporting, accountability and coordination. And since, I don't know, the humanitarian reform perhaps in 2005,
AVS Media Demo.
have been built to support these things. But my organisation, and it's also been mentioned by Luke and a little by Vincent, is that it's not enough now to be accountable and transparent and all of those kinds of things. We're now asked to prove that we work, that we work properly, and that what we do is
AVS Media
the
Demo.
most efficient possible way to do things. So I think currently we have in place systems that answer the question of this panel. Sometimes we succeed, sometimes we fail, and I think in most responses we partially succeed and partially fail to fulfill the information needs of coordination
AVS Media Demo.
and data to donors. But I think that the larger donors who now have this need for us to have an evidence-based response means a whole new set of templates and information management resources that I don't think is in place yet. So at the moment, from my perspective, the donors...
AVS Media Demo.
But in the field, I think it's extremely difficult to deliver that at the moment. Humanitarian data and information, we have systems for, but are our current information management processes, procedures, templates, OCHA mechanisms, how do they step up?
AVS Media
And
Demo.
what's really been on my mind, I was doing information management in Manila, and we were really talking about the difference between an informed and coordinated response to an evidence-based response. Because what we're building on in both cases is data to information, I guess.
AVS Media Demo.
But nobody could really answer my question of, well, what is evidence and how is it different to what we're already doing? So I went about it a slightly different way. I'm sure you'll all recognise an information management cycle. So let's talk about a coordinated informed response. I'm sorry this is very simplistic.
AVS Media
But you
Demo.
start with a question which may be food. You do a needs assessment with your friendly OCHA comrades, perhaps. Data processing and storage. You would have things that you would do for your agency, but you would also, of course, feed the cluster coordination mechanism with your 4 Ws, who, what, where, why.
AVS Media Demo.
And the analysis would include things like SPEAR standards. You would compare the number of people you have to how much food they should be eating, etc. And then we generally put out information products for advocacy, for operation reports, for coordination reports, and of course, which is key to this panel, is our donors.
AVS Media Demo.
Very simplistically, this may be an informed and coordinated response. And when I tried to think about how that would change if we wanted an evidence-based response, I came up with the conclusion of the question would be different, for example. We would want to know the best, the most cost-effective way of doing this.
AVS Media Demo.
Identified, so that we could report to our donor that we are not in fact just responding to need, but we are responding to need in the best possible way based on all the evidence we have. So I've added in red, perhaps we would need different data, but that data that we collect would be question specific.
AVS Media Demo.
I struggle a bit to find or to think about how it would be part of a template or a system, because I guess it would be customised to the question, which would also be customised to the response and the need. Then I think down here, you would also perhaps have special needs for this one question that you're asking.
AVS
Down
Media
here, I
Demo.
thought perhaps the most important aspect that I came up with that would change, would that be at an analysis level, would we need to engage researchers, academics, subject experts outside of humanitarian professionals? And if we want to
AVS Media
prove that
Demo.
our response is the best, then we would have to compare to other responses, or we would have to compare to development context, or we would have to compare to a clinical trial of nutrition that recommended a certain type of food. I don't know. I think the people that we bring in and how we do the analysis, the methodology, would have to take
AVS Media
research
Demo.
and academic rigor, I would assume. And then perhaps we would then be reporting back to different kinds of people, not only for the donors and for the response, but academics perhaps, professional fora, different kinds of conferences, all of that type of thing. So the question that we ask for this panel is how do we
AVS Media
how do we
Demo.
need the data and our own? I think that meeting the need to collect and use evidence in humanitarian phases would really mean involving different people. And if we do bring in, for example, researchers, do they follow the humanitarian imperative? Do they understand it? Do they have the
AVS
same
Media
kind of
Demo.
timelines that a humanitarian would? And what about humanitarian standards and protocols? If there's suddenly a load of health workers flying into the Ebola crisis, which in fact we are facilitating now, how do they deal with humanitarian standards and protocols? How do they understand all of the ethics that was talked about this morning, for example, in humanitarian
AVS
field,
Media
where they
Demo.
are not humanitarians by and large. I'm not saying that sounds a bit negative, but I'm just saying different people and different approaches will have to be aligned with the humanitarian response standards, protocols and imperatives. Will it involve more work in new systems and templates? And I don't have
AVS Media Demo.
except there will be more work to be done and more templates and systems to be made. I can't really picture how that would happen in our current information management and mapping budget resources. I mean, as Vincent said, we're not getting much money as it is to make this kind of information. And to what extent can these needs match
AVS Media Demo.
the data collected? Now, I don't want to insult different here, but everybody wants proof that what we're doing is the best thing to do. Everybody wants evidence from their response saying that it works. And yet, in my mind, donors are talking about evidence-based response and evidence at a policy level. And they're asking
AVS
somehow
Media
to
Demo.
support evidence with data. And how it comes from data collected down here to rhetoric and high-level decision-making up here, I'm not seeing a practical link at the moment. I think many people are aspiring to do it, but when we'll get to a
AVS
way
Media
of
Demo.
creating data and then producing evidence, I'm not sure when that will happen or if that's happening now. And so then it raises the question, how does this impact the need to do work to gather evidence on the ground and what that really might mean?
AVS Media Demo.
In summary, we need new people doing different kinds of analysis in new ways, probably within our existing information management budget, I assume, and with our existing information management staff. So if you have any questions, you feel free to ask them now, but also if you have any
AVS Media Demo.
I'm struggling a bit at ELRA to fit all of these things together into, a proposal and a practice.
Comments?
AVS Media Demo.
Evidence-based diagram. So maybe I will try to make it neat. Because as also in terms of
AVS Media Demo.
one of the key things is to be able to document and compare somehow emergency over emergency. Is it by type of emergency? Is it by kind? I think it's something that now is starting picking up, thanks also to the indicator register, because we will see if we can at least use the same indicator consistently.
AVS Media Demo.
But according to me, that should be actually at the beginning of the diagram, which is, by the moment I identify my question, I'm looking at what I already know and used in previous emergency context, because I need to develop, since my identification of my research question, my comparative framework.
AVS Media Demo.
To demonstrate that my response is working or not. This is the first point. The second point is that although this is a new, it's not a new approach, but I would say that we are getting tools to produce this information availability. The reality is that as of now, we can make a qualitative comparison.
AVS Media Demo.
And emergency, but not yet a quantitative. And I don't know for how many years we will be in that position. I think also in such context, where probably the donor also need to transform the policy in action and allow it to collect the data properly in the same way, pushing for this.
AVS Media Demo.
Enabling this coordinated approach to data collection for different approaches.
Well, I agree. So I'm not going to answer a question, but with your comments, yeah, I think if we land in Manila and suddenly say, okay, give me all the evidence from the last typhoon in Manila.
AVS Media Demo.
Life would be very different. But anyway, long discussion, I'm sure, to be had about that. But we'll move on to the last presentation of this panel, and it's about beneficiary communication.
AVS Media Demo.
Actually, it's interesting to see one of the biggest donors around the table and the biggest humanitarian organization in the world, Federation. I'm trying to take 3 points that, David, you raised during your presentation. You said ensure accountability
AVS Media
of affected
Demo.
communities, make better use of sources and technology to prepare for natural disasters. I'm just trying to take the conversation to a different level. Yeah, we've been talking about accountability towards donors, which
AVS Media Demo.
in previous presentations, and I'm trying to talk about accountability towards beneficiaries with whom we work, and then how can we fill in that gap, ensuring accountability towards beneficiaries, then definitely would ensure accountability towards donors. I'm going to take
AVS
a
Media
real-time
Demo.
example, the Haiti earthquake operation, and I'm just going to talk about a few tools that the International Federation of Red Cross has been able to implement to ensure accountability towards beneficiaries. I would start with a quote: people need information as much
AVS
as water,
Media Demo.
food, medicine or shelter. Information can save lives, livelihoods and resources. This is what we said in the World Disaster Report in 2005. Taking the specific example of Haiti, to be able to collect data from communities and to be able to give data
AVS
to the
Media
community,
Demo.
to know the community. So what did we know about the Haitian population? There's a very low literacy rate, strong oral culture, low television ownership, high radio listenership, high mobile phone ownership, less internet access, but it's growing step by step. Background to the beneficiary communication.
AVS Media Demo.
For Red Cross, community participation is a must. We have successfully worked on beneficiary communications in Indonesia after the tsunami operation. There was intense criticism to aid organizations after the tsunami about listening to beneficiaries. Have we listened to the communities that we work
AVS
with?
Media
Do
Demo.
we really do what the communities want us to do? How are we accountable towards them? And today, accountability has become a responsibility, not a choice. So what do we do with beneficiary communications, community awareness? We provide information to save lives. As well as
AVS
we
Media
get back
Demo.
information from the communities. We feed information that we get back from the communities to programs, to better inform programs about the field realities and on what people need there, other than giving what we have as a clear-cut solution, but just to listen to them and change the
AVS
programs
Media
according to the needs
Demo.
of beneficiaries, and then tell back the communities what we have done. That is the link that we are trying to make. Of course, we give information, we get information back, we change programming, and we tell the beneficiaries on what we have done with the data that we have collected. At the same time, all this will be communicated to the donors.
AVS Media
Let them know
Demo.
what has been done with the money they have been giving to us, but listening to the people who wanted our. We have been having a very intense beneficiary communications program in Haiti, which was very techno-heavy. So using today's technology to give and get information.
AVS
I
Media
will
Demo.
just go through very quick on the tools. We had Radio Rouge, we had a radio show twice a week from the beginning of the operation, real-time radio show live, where you had experts coming in talking about relevant topics, relevant humanitarian topics. And it was not one-way communication, it was not a panel discussion
AVS Media Demo.
where the listeners could only listen, they could call back and give information from the field and say, okay, what you talk is correct, but in the place where I live, we don't need water, but we need something else. So it was giving information at the same time, getting information back. Going back to the first slide that I put, there's a strong radio.
AVS Media Demo.
We used the technology as well as we used the traditional communication tools, graphic design, face-to-face Red Cross. Our base is volunteers. In the 189 countries that we are based in, we have a strong volunteer base. So all these
AVS
techno
Media
tools
Demo.
were mixed with the volunteers and going to people's houses and trying to tell them face-to-face, go with a leaflet and explain to them, okay, you can also listen to the one call every 26 seconds, 142 calls per hour, 3,398 calls per day, 23,000 calls per week,
AVS Media
100,000
Demo.
calls per month. To give information and to get information. And all this information which we were getting went into a research cell in the operation where the data analysis took the data, analyzed it, gave it back to the programs to make the programs better fit the needs
AVS
of the
Media
communities,
Demo.
as well as give it back to the donors to understand the real-time situation in the field. It had different sections. There were surveys, there were health information, cholera, blood donation, vaccination, about other Red Cross projects, disaster management, and general information.
AVS Media Demo.
Last but not least, the SMS system. Again, building on the 70% population having a mobile phone, the easiest way to communicate with the people was by SMS. You know, even after a major disaster, the first thing which would be fixed would not be mainly calling, but SMS, which doesn't need a lot of time.
AVS Media
So from our
Demo.
computers in the Red Cross office, we could send targeted SMSs to any telephone in the country. So if there was a hurricane, if there was a flood, you can understand the situation and then send awareness messages to the communities, selected communities.
AVS Media Demo.
This was a partnership with the mobile phone providers who had access to our database, we had access to their database. And all information which went out was tailored information and was validated information from the Department de Protection.
AVS Media
So
Demo.
we just didn't send information that we thought is right, but we sent information which was credible, and they could SMS back the Red Cross saying, okay, we got floods now and this is the situation, this many people were affected. So this is where that you, in a spec of a second that you get the information that you need and put
AVS
browsing
Media
information.
Demo.
We have every year done evaluations on the effectiveness of this project. 90% of the affected populations received information from the Red Cross. 87% said the information
AVS
was
Media
useful,
Demo.
and 82% said that they shared the information. They got an SMS, but their neighbor didn't have a mobile phone, so they went to the neighbor and shared the information. And the neighbor and them got back together, sent back an SMS to the Red Cross, so that the Cross could fit in to the big humanitarian discourse about the discussions.
AVS Media Demo.
That's it.
Thanks very much, Sabine. Does anyone have a question on this? We've probably used up all of our time and a little bit more. But
AVS Media Demo.
to say we're all here, and to remind you, this is Vincent, Luke, Sabine, Chloe, and I'm Lisa. So if you have any questions, please just yell out.
If you wish, I think we can take 10 minutes. If you guys want to have a it's up to us.
AVS Media Demo.
So if you don't mind going for lunch a bit later.
Okay, you'll be voting with your feet. If you'd like to stay, have a discussion.
I have a remark or a question or comment. My name is Gerd Pausch. I work for the Red Cross. I
AVS Media Demo.
in Haiti, and you mentioned the P-code, which is a very useful tool, but at the same time, designing the P-code and using the P-code can lead into very different operations. The P-code is usually used for collective centers for camps in a lot of
AVS Media Demo.
Philippines. I would say P-code should be the family's home address, because by providing the aid into camps, into collective centers where it's probably needed and pragmatically in the very beginning specifically the only way to run an operation, but at the same time you attract people into camps. You
AVS Media
utilize
Demo.
the aid in the camps. You do not promote self-coping mechanisms. You don't promote people to go back, which was a huge problem in Haiti specifically. So it's for the data guys, it's probably needed to have a lot of P codes practically.
AVS Media Demo.
It should be a P code where the aid should be delivered ideally.
Yeah, I mean, I agree, and also if it's possible, then if the country has a social protection program that you can use for things such as the modalities such as cash transfer, that kind of thing. If it can be linked
AVS Media Demo.
then you have a way for response to understand exactly where people have moved from as well. But it requires a more joined up approach. Beneficiary having an ability to track beneficiary as they move.
AVS Media Demo.
Something that you get very easily, but there are some solutions. So, for example, the last mile mobile solution I think is an interesting first step, where an individual gets a card, you can track how that person what that person has received, and what kind of family makeup they.
AVS Media Demo.
So you can understand a little bit more how different agencies have delivered aid in different places, and that can be linked to location, either their current or previous location. I mean, it's looking at, in reality, these kinds of solutions are out there. They're outside of the humanitarian
AVS
world,
Media Demo.
but they exist with the kind of ability for big companies to deliver goods. They have the technology to do it. It's just having the will to sign up to
AVS Media Demo.
a system which perhaps another organisation has developed, but offers a solution which can improve the way we do. So I agree.
I would say that we need to keep separated, although an addressing system of the fish
AVS Media Demo.
The main use of P-code is true that in some cases could be collective center and camp, but also it's mainly basically to be able to map the entire, all the entire administrative units up to the village, which is very often the most common use that we do. If we consider that in Somalia,
AVS Media
the Somali
Demo.
language is not codified to be written, which means that we are allowed to write the name of the village 10 different ways on the right to do that. Or if you look at the translation from Arabic name using our alphabet, which again means to a different transliteration, if you don't use the type of P-codes, you lose the entire capacity of coordination.
AVS Media Demo.
Beneficially, that's the next step. That's really the ultimate level of capacity to coordinate ourselves. Very useful, especially in the camps, where this is most often, very often, is not known, to make an example. And this is clearly is needed. In terms of P-code to be a pooling factor, I would say no. The response strategy.
AVS Media Demo.
May be or not a pooling factor. If we decide that the strategy as a Italian community to support mainly the collective center in Vigo, this is maybe a pull factor. The fact that the collective center does have or not the people, I don't think is the key behind that.
AVS Media Demo.
Yeah, regarding the question to merge different report formats into one single solution. For example, myself, I'm Olivier Sarrat, working for Group URD, and the donors 10 years ago, almost 10 years ago, have already signed commitments and statements in the good method donations to do so, and actually very little, almost no
AVS Media Demo.
constraints from their side to be able to provide all the funds needs for the taxpayers. And I think definitely they have the will to go in that direction, but there are a lot of constraints for that. And I think on the other side, on the civil society side, we need to invent standards or solutions to push forward this possibility. If we show to them that it's easy to merge information,
AVS Media Demo.
So I think that format like HXL, YATI, or solutions could be good for that. And we'll just give an example. There are several free and open software which try to give it to NGOs so that they will be able to report in a similar manner. So just to say that might just be that's the way to put more pressure and to put back this subject on the table.
AVS Media Demo.
I completely agree. I mean, it does seem that donors, in theory, are kind of behind this idea, but as you say, there are practical issues and everyone's got a slightly different reporting template and everyone's got a slightly different way of kind of managing information, and that requires a slightly different way of reporting it. So that we're kind of going back to basics and looking at all of the different
AVS Media
to
Demo.
find a way, at least, if not all information required, at least some of it can be accessed from one single source. And I know donors don't often get applauded, but Dickens have been really great in kind of leading this from the IATI perspective. And from the perspective of the
AVS Media Demo.
I mean, there is everything that used for IATI anyway is open source and free, but it's a question of there needs to be, I think from talking to organisations about it, it's people aren't going to do it because it's a good thing to do. People are going to do it because
AVS Media Demo.
And so we can't, it actually just is saying, we're not going to give you the money unless you report to IATI, they're just going to report rubbish data. And it's only going to work if it actually works for them and if it makes their life simpler. And the only way it's going to make their life simpler is if it reduces that ridiculous multiple reporting burden. So
AVS Media
the
Demo.
onus is now on the donors to start thinking of ways in which that can be kind of combined. And that is starting to happen, and there is a conversation taking place. But it's slow.
Yeah, I just wanted to add on this one. maybe a bit simplistic, but I wasn't into that.
AVS Media Demo.
When we were working, Coach, I was coordinating the CHF. We were trying to apply the model that they use in Afghanistan to evaluate police. The entire process took 6 months, and the overall envelope was 40% of last year.
AVS Media
A
Demo.
lot of organizations worked 6 months on collected data for no money. And at the end of the day, I was working for an NGO. At the end of the day, the answer that we had from the donors and from the UN was that we didn't have to do it for money because it was all about evidence-based response, and we had to think the whole
AVS Media Demo.
beforehand without pre-oriented for funding, which is sometimes, I don't know, I work in the field and it's sometimes a bit of a hypocrisy because no one is actually working in the field without funding. So we're all trying to find a right balance between that one.
AVS Media Demo.
And then, just to finish on this one, we had, for example, this massive process of 6 months, very, very time consuming. And then USID that would come and invite us all for, I don't know, one-day workshop and say, okay, so what do you think are the priorities for Sudan for this year? And some
AVS Media Demo.
why don't you look at the CHF mapping? They're like, yeah, but we also want other needs evaluations. So, I don't know, we just spent 6 months doing this, and they actually wanted another compiling data sets. It's interesting.
Could you just, sorry, remind us of your name and your organization?
Sorry, I'm Lisa. I'm a member of
AVS Media Demo.
and I was working for academia and now working for students.
Well, I was just going to say something following on from that, and obviously the conversation always comes back to money, and sort of in relation to what you were talking about and changing the way that all system works, and particularly
AVS Media Demo.
bringing in external researchers and evaluators and having kind of peer-reviewed journals and that sort of thing, and how that would be funded. And I mean, the obvious way that would be resourced to me is that there would be an awful lot of commercially valuable information in those evaluations, and I think the first
AVS Media Demo.
do that would be the private sector, because there's a potential to make a lot of money from the evidence that they find from the research that's found. So that then also has knock-on ethical and moral issues in terms of what you're saying about the principles and that sort of thing. If that were to happen, that
AVS Media Demo.
way in which I think we'd be expected to resource that, and it would.
If I could just make a quick comment. I think that information for decision makers is something we hear all the time, but I think it also has to do with capacity building.
AVS Media Demo.
Deliver more evidence and more information, but no one will read it unless we simplify it. So you can work for 6 months, put everything into one dashboard, which makes your head turn grey because you're making all sorts of assumptions that never make it past your, information manager, and then the decision maker doesn't have
AVS
the
Media
capacity to
Demo.
take your satellite imagery. You can say, look, drought is coming, but unless there is some kind of capacity from a decision-making point of view to interpret data, to take the translated information you have and make assumptions about it and make decisions on that, then it really can be a real
AVS
bottleneck.
Media Demo.
And, I have a background as a scientist, and you can do a 3-year project, and in the end your minister doesn't want to read more than a paragraph. It drives me nuts. So now we're asking to deliver more, while the decisions are made on perhaps less. It's very difficult.
AVS Media Demo.
This issue could be looked as a capacity building issue, but on the other way around, not only capacity building issue for the managers, but maybe more also capacity issue for the field workers, the project manager, etc., etc. I will go back to the ideas that has put Mr. René Sarnelli during his presentation.
AVS Media Demo.
This information management cycle could be looked as a vicious or virtuous cycle, and the idea which will pinch me a lot, because we try not only but mainly to produce data to make evidence to help decision makers at the top management to make decisions. And actually the risk is that top managers may say, okay, but I will need an extra information of more information. That's the idea of this vicious cycle.
AVS Media Demo.
The question of untrust of field workers not able to make decisions on their own land, just collecting evidence on the field with their own five senses, and not maybe having only evidence and data, etc., but able to make decisions because they have experience, etc. So that's where, I think there's a question of capacity building on the field staff to be able to
AVS Media Demo.
trust in the organization. Because building thousands of information won't always help to make good decisions. And this information won't be used for decisions in the end. Other inputs will come.
Well, I totally agree with that. And ELRA commissioned an evidence review on health in humanitarian
AVS Media Demo.
and it went to the London School of Hygiene and Tropical Medicine, and they came back with the results that since 1980 there have been 6 papers published that linked health outcomes with WASH. And the only
AVS Media
that
Demo.
was, oh, we don't know anything about the health outcomes of water and sanitation in humanitarian response. And of course, that's completely ridiculous. And the person who's been working in WASH for 20 years would say, by the 1800s, we knew that water quality was linked to good health. Why would you want to produce evidence
AVS
about
Media
that?
Demo.
To do that kind of academic research, this is the outcome you came out with. And we've had all sorts of problems with issues like that. And I think that, yes, we can't say, well, we don't have evidence, therefore we're all going home. Obviously, there's a big problem, I think, in sometimes what we have to produce and what we know.
One thing
AVS Media Demo.
knowledge,
Yes.
passing it on was such a high rate of turnover, staff and ideas as well. The information management piece is crucial. Resourcing that obviously is something that's very important, but also professionalising the sector. So
AVS Media Demo.
Humanitarian Leadership Academy, which is a new project that we're working towards. That hopefully will help, but I think there's a certain level of minimum requirements that there should be in terms of how you access, understanding how you access this kind of data.
AVS
how
Media
it's,
Demo.
Presented for decision making, because you're absolutely right that as you get further in the chain, it gets filtered until if you're any more than one sentence in a submission to a minister on a whole sector, then you're wasting time with this if you want to look at it. So you really
AVS
have to
Media
be able to
Demo.
summarise at different levels of the decision making hierarchy, and that requires professionalisation of how to use, access, use and present the data.
AVS Media
If you have
Demo.
more questions now, please feel free, obviously, to approach anyone during lunchtime. But thanks for coming. It was very interesting.